Closing hospital beds, waiting times and residential care for the elderly, all issues that featured today in a statement from the Health Minister updating the Assembly on the progress of transforming your care. It's been a challenging year, he said, but difficult decisions still lie ahead.
In Northern Ireland, as elsewhere, we have a growing and ageing population, a growth in chronic conditions, a growth in demand and an over-reliance on hospital beds. All of this is set against a backdrop of economic and financial constraint, and given the challenges ahead, the way we work now is not going to work well in the future. This is not a criticism, it is a statement of fact. There is still a lot of work to be done, but I know that staff are committed to working to improve acute hospital care. One practical outworking of the transformation and the shift of resources from hospital to the community will be the reduction of beds in our hospitals. This cannot take place in a vacuum. In particular, it must take place with full and transparent engagement with patients and service users so that we know what is changing, when it is changing and why it is changing. I want better services for all older people, both now and into the future. And to this end, my department has asked the HSC Board to lead on a regional project for coordination, consultation, engagement and implementation of change around services for older people. I expect all future trust proposals to be part of the new HSC Board oversight arrangements, but with local consultation and engagement. I want to assure members that the future of statutory residential care homes will be considered on a case-by-case basis, recognising that we must do what is in the best interests of the current residents. The latest statistics show that although performance improved significantly in May, the health service is not meeting the standard that 95% of patients attending an emergency department should be discharged or admitted to a ward within 4 hours, nor has it met the standard that no one should wait longer than 12 hours in an emergency department. But there are signs of improvement within hospital services. This can be seen, for example, in waiting times for elective care, where both the numbers of patients waiting and the length of time they are waiting are being driven down.